The anti-vax movement is not just a group of weirdly anti-science individuals on social media, nor are they bots. Some are maybe foreign agents looking to sow discord in the US healthcare system, but a large chunk of them are people who at one point had good faith questions about vaccines, about science, about treatments that they saw propaganda about and are now questioning for themselves. On this week's episode, you're going to hear firsthand one woman's account of her own path down the anti-vax rabbit hole and back again. Grappling with questions she had after being exposed to pseudoscience propaganda, she sought answers in the healthcare system only for the system to basically say to her, trust me, bro. Let's hear firsthand her thoughts on the matter and how we as doctors and nurses can do better. You're listening to the Jaferd cast. Let's rock and roll. Welcome everyone to this episode of the Jaferd cast. I am your host, Dr. Mark Pappadakis. No one particularly special, just another freaking ER doctor. This week we were talking with Heather Simpson, mainly about vaccines and her role in being an anti-vax influencer, now turned pro-vaccine influencer. It's going to be an interesting conversation. If you enjoy the content, please be sure to like and subscribe. I'm on YouTube, Spotify, Apple Podcasts, all your favorite platforms. Find us on social media as well. I do post clips of episodes and in general spam the ever-living daylights out of my followers with medical information and medical nonsense. As always, I encourage constructive thoughts, comments, and suggestions. You can leave them in the comments section to me in YouTube and email them to me at jaffordcast@gmail.com. If you're in the healthcare field and interested in being on the show to discuss topics in healthcare, or if you have a past interest in healthcare and just want to rant and rave like I do, please feel free to reach out as well. As a general reminder, nothing we say in this episode should be considered directed medical advice. We mostly just talk out of our asses. So without further ado, let's bring in Heather Simpson. All right. Hi, Heather. Welcome to the show. How you doing?
Hi, I'm good. Thanks for having me.
Absolutely. So, this is a medical podcast, but you are decidedly non-medical. So tell us about yourself. What do you do for work? I know you're a mom, but what else is going on?
So right now I was traveling and speaking basically on vaccine hesitation and what one can do to possibly change people's minds. But with RFK Jr., things kind of shifted a little bit. I'm doing mostly photography and being a full-time mom.
Awesome.
But I am speaking on the side here and there. It's interesting to watch. Everybody's funding kind of got cut. I mean, I say everybody, but it
A lot of
took a
people's
big
funding
dip.
got cut.
Yeah, it was wild, and it's kind of slowly coming back up, and it'll be interesting to see the next year.
Yeah, and for those who don't
happens.
know what refer to that, the NIH recently came out and basically slashed a lot of federal funding to universities and institutions for a various number of reasons. And, there have been some clawbacks with that. I don't know the exact numbers, but universities basically lost a lot of money. So a lot of side projects kind of got shelved. Researchers got canned. Some got hired back, some didn't. So it's all been in flux with the academic side of medicine lately. But so you were actually speaking, you told me actually before we started recording, you spoke with Chelsea Clinton about vaccine policy and all that. Did you speak to her about that specifically or something else?
Yeah, so I don't know if she still records her podcast anymore. She had a
Interesting.
podcast a couple of
Uh,
years ago, and
this is
I
false
don't.
advertising. This platform's giving false advertising. That's what you're saying.
Yeah. Yeah, I feel like it didn't continue, but I don't know. And when I first, started vaccinating and I made a post why I kind of changed my mind and I'm moving forward with vaccinating, CNN reached out and then she got wind of it and she had me on her podcast and
Interesting.
that was like the start of everything, I think.
So how long ago was that? Because I guess let me start over. Walk me through kind of the timeline here. I know from your social media posts, from other media you've done, you basically became a mom, you were pregnant, and then you started just kind of cursory looking into this on your own, looking at information, and then you kind of went down the rabbit hole. Is that pretty much it?
Yeah, so in 2016 I wasn't getting pregnant. I was married at the time and I asked my doctor, I started going to like researching wellness in general. And I was like, could this affect fertility? And I asked my reproductive endocrinologist, can food and our diet affect fertility? And he was like, no, like it's not going to help, but it's not going to hurt. And I was like, that doesn't
That's weird.
sit right.
Yeah, that's a weird response.
It was weird. I mean, at the time I was like, a conspiracy, he's getting paid directly by
Right.
me not getting
Hmm.
pregnant. But I went further and further down this rabbit hole, and I was researching inflammation and foods, and it's like that's okay. That's eat for your body, eat what makes you feel okay. And I got pregnant within 2 weeks of changing my diet. But and I don't know, like, this is a kind of a weird thing, but when I talked about that later after becoming pro-vaccine, people were like, "You can't say that. That was probably an accident." Like, that would and I was like, "Why can't you say that?
Yeah,
That makes the pro-vax side sound crazy. That makes
correct.
them sound like they're in a cult. Like, you can't both things can be true. Yeah, I
Hmm.
can't prove that." But what that did do is make me kinda hate the science world and the medical world, and I was like, "My daughter wouldn't be here." I went down
Hmm.
that path, and I was like, "How dare you?" And, I just kinda researched and researched, and I stumbled upon a 9-hour docu-series. I don't know if I can say it or not. The Truth About Vaccines. I don't know.
I
Blah,
don't
blah,
know.
blah, 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 blah.
I haven't had like a takedown yet. Like I said, nobody watches this show, so it probably doesn't matter.
Don't say that because right when you say that, it blows up. That's
That's right. That's true.
vaccines.
That's true.
Goes back to
So,
fight you.
so it was a 9-hour docu-series. When was it? Oh, let me. So when was it published? Do you know when was it actually produced?
So I think it was like maybe 2014 or 15. It
Okay.
was Ty and
All
Charlene
right. So
Bollinger.
10 years or so ago. Interesting. That was actually pre-pandemic because I remember
Yes.
in, like the whole plandemic thing came out in 2020. That was a mess and a half. So there's interesting that there's stuff that predates obviously 2020, but
Huh?
in a very organized fashion. Like this thing existed that not many people know about.
It's so crazy because I mean, this was back in the day when we paid for things, like movies, and the way they marketed it was like, if you want to keep your kid healthy and alive, you need to watch this. And we're going to be middle ground and show both sides.
Mm-hmm.
And me and my ex-husband were like, well, we need to know. We have to keep a child alive. And we ended up paying like $200, I think.
Wow.
Which
So we're
is
not talking a
crazy.
movie ticket here. We're talking
Indoctrination series.
okay.
Yeah. There were a lot of doctors on it. They promised to be in the middle, but they were pretty
Doctors
much
in
anti-vax.
quotes.
Yeah, they
Yeah.
were very anti-vax.
Yeah.
Like,
Well,
they're
listen,
still influencers now.
yeah, I was going to say, and here's the thing, right? Like you can still be a licensed physician and be considered a doctor, or you could be a PhD and be called a doctor as well, but are you practicing? What's your specialty? What's all these little things that, people will advertise their credentials, but then not really give any background on that. And I'm going to be speaking about functional medicine and our incoming Surgeon General, potentially incoming Surgeon General later with another physician. And we're going to discuss a little bit about that. So free preview for the next episode for the listeners, but that's a very common tactic where they bring on doctors. You don't really know their specialty, or maybe you do know their specialty, but are they practicing whatever? And then that kind of lends credence to a lot of their claims.
Mhm. Yes. Yeah, I mean, I've had a lot of people put themselves on the same level as, and I wouldn't even say level, but basically the same type of doctor as an ER doctor when they are, say, maybe a chiropractor.
Hmm.
And with the same kind of, "Well, let me tell you about vaccines." I don't know, I felt kind of tricked, and then they had, RFK Jr. on the series, and at the time, I was like, "This guy, he says he vaccinated all his kids. He's not anti-vax, he's pro-safe vaccines." And I was like, "How logical is he? He's a lawyer, like, he is a trustworthy dude, he's thinking about this clearly, he's a Kennedy, like, he was a big reason why I became anti-vax."
Interesting.
Yeah,
And he was an
so
environmentalist too. I mean, he was a
he
very much
seemed reasonable.
liberal environmentalist, worried about that kind of stuff.
Right, and that's kinda like he's not he doesn't come across as, like, a deep conspiracy theorist, he
Right.
seems very rational,
Right.
and, yeah, after this series, I was like, I don't hate children, I don't hate my future children, so of course I'm not gonna vaccinate because, I don't wanna kill them. I
Hmm.
wasn't even thinking autism, I was thinking they would die. She will die that night.
And
They
that's impressive that it left that kind of a mark on you,
Oh,
that
yeah, I
message.
mean, they blame SIDS on vaccines. I mean, that's a
I'd
big
forgotten about that. I remember that was a big talking point years and years ago about the anti-vax points. Before it became more about autism and other things, it was SIDS. I forgot about that.
Yeah. I was so scared that I was like, I could be so I don't know how to say it, but almost so lucky to be scared of autism if she could even survive to that point,
Hmm.
but I know she'll die before.
Right.
I was
Yep.
horrified. And they also blamed allergies, viruses, all that on
Mm-hmm.
vaccines.
Mm-hmm.
So, they almost promise like an illness-free childhood if you don't
Which is
vaccinate.
incredibly ironic. So you walked out of the movie theater
This is at
with this
home.
impress. Sorry, I'm sorry. It
Yeah,
was
this is the docu-series we got on the internet.
okay. So
Yes.
you walked out of that, and basically you're like, you walked away from that, and you're like, okay, we're not doing this. I'm terrified. What happened next? Did you discuss this with your like? How did that all like?
Yeah, I was supposed to get a tetanus shot when I was pregnant. Obviously, you're whooping cough. And I asked about one of the ingredients I had heard about in the series and read about. And my OB-GYN was just kind of like, "You're not one of those crazy anti-vaxxers, are you?" And just kind of shut me down. I was beet red. I think I cried in the car. And that was all he said. And I just never brought it up again. I feel like he didn't even know what the ingredient was that I said. I think it was polysorbate 80. I feel like that was the first time he had heard about it. I was like, this is not going to go anywhere. I'm gonna go cry. And then when I brought it up with my pediatrician, like at her 2-week checkup or something, she had really severe apnea when she was born. And so the PD was like, well, if you want her to live, if she gets, a cough during her apnea, then if you want her to live, like,
Mm,
do I want
mm-hmm,
my child to live? Don't go into a conversation like that. Obviously, an anti-vaxxer wants their kid to live. They wouldn't be anti-vax if they didn't. They're scared.
mm-hmm.
That was the dumbest approach I've ever seen. I don't care if she hears this, it was stupid. It just pushed me away so far. I pushed and pushed for the diagnosis for sleep apnea. She clocked in at like 144 events per hour, and I think severe is like 40.
Oh, wow.
And that was after fighting for a sleep study for 2 months. She
Who
was
did you
on
fight?
oxygen.
Out of curiosity, who did you fight with? The pediatrician to do the sleep study, or the insurance to pay for it?
So actually, it was the pediatrician. They sent me to the ER when, okay, so I put this little sock monitor on her that was not FDA approved at the time.
Yeah, yeah. Like we have the outlets now. 10 years later, we
Yes,
have the
that's what it
outlets.
is.
Uh
Yeah,
huh.
yeah. And it went off the first week at like 60 something percent oxygen. And it did it several times. And I was thinking it was malfunctioning. The PD sent us in thinking, well, she broke her collarbone during birth. Maybe she's like gasping for air from pain. They gave her Tylenol. And it
Oh,
didn't get better. They basically were like, you know what, this isn't FDA approved. Like the thing that caught it was the problem. So you need to stop using that. The ER said that, the PD said that. They were basically like, "Just set your alarm, check on her every few hours to see if she's purple.
sure. Let me
Don't
just
use
set a
that."
timer. Make sure my child is alive. All
I
right,
was
cool.
like, I think I set my alarm every 20 minutes for 2 months. I mean, I was like manic, crazy mom at that point. I was, "You have to send her for the sleep study." "Why
Yeah.
would we do that? She's fine. You're being a new mom. You're being an anxious new mom." And they were like, "Okay, just basically to shut you up, we're gonna sent me to the sleep study 5 hours away." Even the sleep doctor was like, "You're being an anxious new mom. This is periodic breathing. This is," and I was like, I know what periodic breathing is. She's doing it for 5 hours straight. She's turning purple. "Well, you shouldn't use the non-FDA approved device." At that point, I was like, if I hear the word FDA or if I hear the term FDA again, I will lose my mind. They were going to send her home without a sleep study after the sleep doctor even saw her. And I prayed, like, please let her fall asleep. Like right now, I just need her to sleep. I need the doctor to see this. She fell asleep within 5 seconds. They saw and they were like, "We kind of see what you're saying. You're an anxious new mom. Just to like calm you down. Just to calm you down. We're
Mm-hmm.
going to do a sleep study." And they transferred her to ICU in the middle of the sleep
Gee
study.
freaking whiz! Look at that. Go
Yeah,
figure.
yeah. So she was on oxygen. I had a new sleep doctor after that, and he changed my life. I did a lot of research that week, and I was like, "Hey, she has severe reflux. Do you think it could be she's not responding to the CPAP? She's responding to oxygen, which is weird for apnea. Do you think she's, maybe burning her chemoreceptors and not regulating CO2 and O2?" And he was like, "Yes, I've never heard of that. That's it." It was the first time a doctor had, like, taken my anti-vax Googling on the toilet research, you know what I
Mm-hmm.
mean, and
Yep.
actually listened, and we worked together, and we made a plan, and she was healed, like, she was having a big reaction to milk and all this stuff, and the reflux got better, the apnea got better, everything started getting better because we worked together. That same appointment, we had a student doctor there, and she was like, "What? I'm sorry, what? Real quick, what did you put on her foot? What was that?" And I said, "The outlet, the sleep device that saved her life." And she was like, "With all due respect, it's not FDA approved." And I said, "Yeah, but it saved her life." And she goes, "I know, but it's not FDA approved." I
Medical
was like, "So
students,
she'd be dead." Yeah, that's
if
the
you're
price
listening
we
to this,
pay to
medical
work with her.
students, just sometimes it's best to just say nothing. So
Just, yeah,
just, I'll be
I
honest,
helped
like
you
I don't know
learn.
if I should say that as an educator, but sometimes it's best to just stand back and then at the end of the visit, speak to your attending and say,
Yes.
"Hey, Is that okay? And then,
I mean, yeah, I've talked about her so many times that, like, I hope that she has, like, had a revelation since then that don't say that. I mean, the FDA
I
is not the end all be all.
so let me sidebar for a second. I had my cousin on the episode on the show, the last episode actually, which was over a month ago. I'm sorry, I'm terrible at uploading new episodes. It's been a month, but anyway, my cousin was on. She was a breast cancer survivor, and she had a double mastectomy. And the fellow, she told us this after everything else was done. She was in the prep in the pre-op area when the fellow to the surgeon came over and said, "Are you sure you're ready to go through with this?" Like she's like in a gown, prepped, the hat on. It's an emotional day, and now
Holy
it's
cow.
like, "Are you ready for this?" Like
Are you
my
sure?
cousin and her husband lost it, and for like just no, you don't do something like that. Like that's
No.
just you don't throw doubt into this. At that point in the game, we're done. We're doing this. We
Committed.
respect it. We're committed. Oh, like this is yes, and this is two examples of how interactions that can just completely throw a monkey wrench into an otherwise positive or stressful situation. That it's like you got to engage your brain a little bit here.
Yeah, it can change someone's, like, the course of their everything, that involves the medical system. It did for me based on what she
Yeah,
said. I was like,
yeah,
"Well, okay." So we
hmm
worship the FDA, we worship the CDC. I am so done. I am so if you had a chance at convincing me to vaccinate or go towards Western medicine, it's gone forever.
hmm
Yeah, there's no way. I did appreciate the doctor, but, I I kinda clocked that, like, in comparison to
Yeah,
everything
yeah. I
else.
mean, that's the thing. What that negative interaction that you had just far exceeded anything that physician that you were dealing with could have done at that moment.
Yeah.
And
Yeah.
it lasted for clearly a while. What was the, doctor's name? The one you had the positive interaction, the sleep study doctor. Do you know what her name was?
I will have to it was actually a guy. The first one was a girl, the second one's a guy. I'll have to look it up because I don't remember.
Okay,
I mean,
not a
I need
problem.
to look it up anyway. I need to, like, reach out and be like, "Thank you.
Yeah, yeah.
He's alive."
Alright, so now that your daughter at this point is how old? Like 2 weeks, 1 month around this time?
2 months.
Okay.
So, yeah.
So you got the sleep study, kinda confirmed everything. What happened next?
We just kept on keeping on. She kinda slowly got better. I mean, she still has sleep apnea here and there, but it was nowhere near, like, severe. They thought she would die that week kinda thing. A year and a half later, so she was 18 months, and ex-husband was working, like, nonstop in West Texas, and I didn't have friends or, like, family close by, and I would kinda watch. There was one girl that started talking about her anti-vax views on Facebook, and I was part of a Bible study that all the girls were pro-vax. I couldn't really talk about my anti-vax views, so when I saw this girl, I was like, "She's actually saying that out loud, that's so embarrassing." And then I kinda lived through the comments, and I was like, "Oh my gosh, these girls are agreeing with her." It was mostly girls and moms, and I just kinda stalked them for a few weeks, and I was like, "Wow, they're really bold." I really that would be cool to have, like, a support system, and but I'm also so embarrassed. I made this post, like, February 2019, thinking that it kinda sounded middle ground. It did not sound middle ground, but, I tried to tie it into, like, the MTHR gene mutation and methylation and not being able to, like, process certain chemicals and vaccines and, certain genetic tests should be done, and I thought I sounded, like, so on point with,
Mhm.
"Let's be hesitant, let's not be anti," you know?
Right. It's good to ask questions kinda
Yes,
thing. Yeah.
I was very but it was a very anti-vax post looking back, and it got shared several hundred times overnight, and then Facebook took it down, which actually made the anti-vax world, like, rally around me
Yep.
because they were like, "I must see it."
It's a conspiracy, they don't want you to know this. They.
Yes, they don't want
Yes.
you to know this, so then it got, like, pushed big time that week again, and that caught the attention of, like, the Pro-Vax world, and they, like, really blew me up because there were, like, a dozen hate pages, like, created about me within a month, which was crazy because I would actively, openly not actively, I would openly talk about, when Charlotte would get strep, like, we're going to pick up her antibiotics, like, gave her Tylenol, gave her Motrin. I was never like,
You're not
"Oh, I'm"
anti-Western medicine. You
Yes.
were specifically, at the time, obviously, I
The death.
hesitate to say, I hate to say call you anti-vax at this point. Like, yes, you didn't vaccinate your child, but it was mostly because you had a lot of questions that doesn't seem to be addressed at this point.
Right. No one could answer the questions I then had in like a satisfactory way. The best they could give me was like, well, they're safe and effective. We have studies. Like, oh my gosh, you can't answer my very specific questions. It's fine if you don't know, just say that. They'll let me like go about my life, keeping my daughter alive because nobody can answer these questions. I'm not going to vaccinate her on safe and effective advice. There's no way. I believed adamantly that the aluminum in vaccines would slip through the blood-brain barrier and cause inflammation. If there wasn't, I mean, if it couldn't do that, the polysorbate 80 would, encapsulate it so it gets slit through as like a Trojan horse kind of thing and then cause inflammation or death
Hmm.
and nobody could tear that down for another year and a half. Nobody could. And I felt like I knew so many detailed questions. And a lot of my anti-vax friends still believe those things, which I know those are not true anymore because someone actually tackled those questions later and changed my life. But at the time, I was like, you tell me it's safe and effective, and they've done studies. Like they haven't studied the current schedule.
They haven't studied
I just,
this.
yeah,
Right.
yeah, they haven't studied this.
They haven't studied my question.
Yeah,
Right.
and there's no reason they haven't. So, I was not full-blown conspiracy theorist. I was more like, I mean, people like money, and we follow the money, and that makes sense. That's
Yeah.
that was as deep as I went. I could not get on board with, like, a lot of my followers were flat earthers or, all
Yeah.
that, and I was like,
Terrain
"Why?"
theory is becoming a new thing now as well with a lack. So terrain theory, for those who don't know, is the idea that it's basically like miasma theory back in the Middle Ages, where disease is not caused by germs. It's caused by your environment, is caused by an imbalance of humors was, back in the day, but now it's more like the environment causes disease. So if we clean the environment, if we eat clean food, you don't get disease. That's all a myth. Antibiotics don't work. There are no such things as viruses. That's
Well,
terrain theory. And that's a lot of what RFK believes and has pushed in other forums as well.
wait, he believes that?
Yeah, he does not believe in germ theory as the cause of disease.
No, I didn't know that.
Yeah.
Oh, no.
I did a video on it back in the spring, actually, when we talked about this in regards to like the ACIP. But yeah, he's not a
Embarrassing.
believer in. I don't think he believes in terrain theory, but he is not a believer in germ theory specifically.
Awkward.
Yeah, a
Oh,
little bit
wow.
awkward.
Sorry. Holy crap.
Um, so you, so you were basically called a premier anti-vax influencer. When did you start to become? When did you embrace that label? Let me ask that. How long did it take you to embrace that?
In like a month, like March 2019, when I saw when the hate pages, like they would take every single thing I did and posted and just blow it up on hate pages. And then I realized, like, oh, I might be like, I'm kind of getting influential. And I don't know if that's a good thing. When I would wake up to a lot of messages from anti-vaxxers asking me like health questions. And I would have to answer, like, hey, I don't know.
Right,
Because I wasn't going to toy with that.
right.
But I kinda just had fun with it because I have a background in film and TV, and, like, I used to do acting in high school, like, I'm just very, like, theatrical and big-natured anyway, so I just had fun with it, I didn't take it so seriously, I had fun with, like, the hate pages a little bit because I was like, "Yeah, like, it's not that serious," but then it kinda became serious after I did the measles costume.
Oh yeah, I want to pull that
That
up. So
was
this
yeah,
was Halloween. This is 2019, that same year that you did
yeah.
it. S- Um, hold up, let me see if this works here. In 2019, you decided to be. It says here, trying to think the least scary thing I could be for Halloween, so I became the measles. Um, and that's you. You
Doesn't even
got
look like me.
dressed up as the measles, red spots, and this and that, and th- yeah. Um, I'm not gonna lie, it's actually a pretty good job on the red spots. Like that actually looks like it could be a good like smallpox costume if you really wanted to bring it back again. Don't,
Yeah.
obvious for obvious, but okay. So now you went as that, and again, that was in part more of like a joke, but it was also like, but a lot of both the anti-vax and the pro-vax committee also saw that as like almost like a rallying cry in a way.
Yes. One of the girls that kind of, hated me at the time. She called me Syphilis Simpson after that because she thought it looked like syphilis, and I'm in her phone as that now. Sif Simp, and we are good friends now.
Syphilis is more of like a diffuse rash, not less red spots.
She was like, "No matter what, it's not measles." But I just wanted to, make my friends laugh, and I was like, "This looks like I'm scared of measles, so I gotta think of something real stupid," and that's why I said that caption. But I didn't really think it would it was very much, like, tasteless and heartless, and that's what I really thought it would just kinda share with my friends.
Hmm.
That I was sitting in church and I checked ironically, I checked my phone, and I was like, "I'm gonna refresh this," and that's when I realized it was getting shared, like, 50 times a minute.
Damn.
My brother sent me a Reddit link, and this was 2019. I was not aware of Reddit really as a
Hmm.
as a concept. That's when I discovered Reddit. He was like, "Are you on the front page? Like, you need to get off the internet, save our
Man.
family name." Oh my gosh.
Wow.
And it was over after that. I was like, once it starts going viral, it's like a
Yep.
virus. It
Yep. Yeah.
has a mind of its own.
Correct. So now what happened? So of course, that was 2019. 2020, we had COVID.
Yeah.
What did anything, if anything, happen during COVID? Because obviously, lockdowns, masking, Operation Warp Speed was a thing.
Well, so I want to go back a little bit. Like I didn't take the whole thing as a joke of being like an influencer. I just didn't. I would kind of be funny on purpose. I just was glad to have a community of people that like what we. I actually had mom friends. I would say things like, at this point, you're statistically more likely to get killed by Hillary Clinton than the measles. I would say like cheeky things all the time, and just yeah. So just kind of, I was ornery. But after the measles costume, somebody sent me a picture of like a child that had died from the measles, and it was like her hand in the hospital. And the Samoa outbreak happened 2 weeks after my
That's
costume.
right. I forgot about that.
And I was
Yeah.
like, there ain't no way. How did I do that? Oh my gosh, I'm so stupid. And I just had this like, oh, this is pretty serious. I'm lucky to live in a world where I don't have to worry about this. But oh my gosh, what if Charlotte had died of the measles and somebody made a costume like that? And it just kind of snowballed into being a little bit more serious.
Hmm.
And then when COVID hit, I was obviously wearing a mask, and I noticed a lot of my followers were like, "Well, we shouldn't have to wear masks." And I kind of got the ick from that, as my daughter would say, the ick. I just kind of was like, why would you not wear a mask to save a whole life? That's weird. We're not injecting masks. Like, what are you doing? Why would we not? So I started kind of speaking up for that because I wasn't going to just throw myself into a camp to say that I'm just in the camp. I'm still having my own thoughts. And I
Hmm.
spoke up for that. And I kind of got pushed away and kind of started to lose my following.
Interesting.
I started seeing things differently, and I remember I haven't really talked about this much, but one of the things besides the mask, or standing up for masks, around that time, I was like, this is kind of an issue of public school rights, and like, nobody's forcing your child to go to a school, and nobody's coming into your home and forcing your child to be vaccinated. Like, we do have laws for a reason, and they would come back with, "Well, we're paying taxes," and I'm like, "Yeah, but you're paying taxes for the roads, and you're not deciding road work, and then the layout of land and the laws of the roads." Well, I don't know. I was starting to kind of put together like the entitlement of the mask,
Yes.
the entitlement of laws. I'm like, you want to have your cake and eat it too. And something I'm not going to do is be entitled, actively knowing I'm being entitled. Of course, I was being entitled, but
But it's the idea of personal freedom and the intersection between personal freedom and public health.
yes,
And, people say that, well, we mandate vaccines for public schools, and, that's not right. And there's legislation in Florida, for example, and I think Oklahoma too, that's looking to remove those. And the question that I have is, okay, well, who says you need to take your child to public school? I think that's what you're trying to say too. It's like,
yes,
there's no law that says you have to take them to public school. There's a law that says they need to be educated to some capacity, but, homeschooling exists, private schools exist.
yes,
And yes,
yes,
private schools are obviously expensive and public schools are free based on our tax dollars. But then, the question that becomes your personal freedom stops when you're putting my health at risk. And I
right.
think that's a very difficult concept for people who, the personal freedom, or personal, excuse me, the personal choice camp can't really reconcile too well. The idea that we have a service to each other, which is public health, that we need to recognize if we want to live in a society that we have built up in this country, in other countries
Right.
as well.
Right. That's just the fact of the matter. You live around people. You are a part of a society. That's just what it is.
So it's interesting to hear that it was the onset of COVID that started to make you question stuff, because from my experiences, it was COVID that has pushed people into a lot of the
Yes.
anti-vax camp and, massing and things like that. But in your situation, it was the reverse. It was, well, this is not good. We should kind of take precautions here. And then all of a sudden that community just completely turned on you.
It's so weird. And I haven't really been able to figure out why COVID was the thing that kind of pushed me toward pro-vaxxers or Western medicine more so. But I think it was just seeing the entitlement and watching people die from exposure when they didn't need to be exposed. And then just the weird, like, well, my kid's not going to see how faces develop and expressions if everybody's wearing a mask. Like, I'm sorry, what? That is such a stretch. Like, what
Yeah.
are you doing?
Yeah. We're not telling you not to mask in your homes. Clearly your child's going to watch your mouth and see your
Right.
face and things
You're gonna
like
be
that.
okay. Like,
Yeah.
this is so dramatic. And I had people reach out, like, I'm a single mom now, but like at the time they would be like, I'm a single mom. I can't homeschool my kid. And I remember
Hmm.
thinking, that sucks. But like that's not really the public health problem as much as you sending your kid. I don't know, like nothing was adding up. Like that sucks. I'm not getting past that. Like
Yeah.
you're in a situation, but this is I don't know how
So
I had
it
such a
sucks.
problem.
But no, I think it's easy to stop there. It's like, well, that sucks. I'm sorry.
Yeah.
And the thing is, a pandemic, a global pandemic, sucks. And I
Yeah.
think at the end of the day, but it's true, right? Like we have millions of people across the globe who have died from this virus that's still lingering, not
Yeah.
nearly as fatal, clearly, but
Right.
still lingering, still causing disease. But at the outset of this, people were dying in droves, especially on the East Coast and my colleagues and what I saw in the ER and ICUs. And I think the reality is, yes, pandemics suck. They take lives, they take freedoms, they limit what we can do with our lives. And we've taken a lot of these for granted until suddenly it becomes a choice of, well, do I protect my fellow person or do I just, live my life and roll the dice? But by doing
Right.
that, you're putting somebody else at risk. And it's just, I think the answer to that scenario is I'm very sorry, pandemics suck. Like that's just
Not great.
this
Yeah.
not great.
Yeah. It's a bad situation. And if you're
Now,
not going to vaccinate, wear a mask. Like that was my thing. Nobody's forcing you to vaccinate with the COVID shot. So wear a mask. Stay out. Don't breathe in people's faces. Do the bare minimum.
right.
Like, come on.
So now, it's 2025. Your daughter is getting vaccinated and she's treating it like a normal child would get vaccinated. Like, my daughter, like, oh, time for a shot. It's like, oh boy, here we
Exactly.
go. When did you kind of make the decision was there a conscious decision at one point to leave the anti-vax community, or was it more that you were just completely pushed out?
So in the summer of 2020, I kind of had some anti-vax friends still, but I had kind of, been pushed out, kind of deplatformed myself, just kind of like, I don't want to be this, I don't want to be in this role. And I reached out in the summer to a couple of doctors online that I kind of knew of in the Pro-Vax world and a couple of scientists. And I was like, I'm just going to be real. I can't change my thinking because nobody can answer my freaking
Yeah.
questions. Like, if
Yeah.
you can you just answer these? Like, can somebody I would love to be wrong. I would love to be normal. I would love to feel like the world is safe and I can trust doctors. And I had two people answer and they explained he's a blood-brain barrier specialist. He responded to my question about aluminum and he was like, well, check all of the studies that anti-vaxxers cite where they think that aluminum is causing XYZ, but go to the methods section, guaranteed it's talking about environmental aluminum because the type of aluminum found in vaccines is not fat soluble, is too big to fit through the blood-brain barrier. It physically cannot do what you're saying it can do. And then I had another a scientist respond to my question about, well, polysorbate 80 can actually encompass these and slip past the blood-brain barrier because of a study, a while ago showing that it could do that, like it could open up the blood-brain barrier. And he took the time to be like, that fear is, a little bit founded. It's a little warranted, but it's wrong based on a study, 40, 50 years ago.
It's fair, but you're wrong. Sorry.
You're wrong. And I was so desperate. I was tired. I was like, I wish I could go back to when I was oblivious to anything and just trust doctors, but I know too much. I know too much
Yep.
and I
Yep.
can't undo it.
Mm-hmm.
And he said, the study showed that given enough polysorbate 80 injected straight into the carotid, you have a chance of opening it up, which is awesome for like brain cancer drugs and things like that. But he said,
Mm-hmm.
let's put it in perspective. You have, an average newborn baby. You'd have to inject, I think he said, 3,600 doses of hepatitis B straight into their neck to have a chance at opening it up. So, I always say CPS would be their first.
Interesting.
And that was the first time. I was like, you answered my question. And I just was kind of like floored. I was like, what if I'm wrong? Like, what if all of my questions could be answered? And then I slowly started developing trust with people, and they would take the time to actually not just say, well, how their vaccines are safe and effective. We've
Right.
done the studies, but they broke down like the actual questions. Cause I was like, you don't understand, not to be dramatic, but if you don't answer my specific question, I will not vaccinate.
Yeah.
Like the life of
Yeah.
my child depends on you. You have to answer it. You can't go past this. It's so, I mean, they answered it. That's why I'm such a big advocate for medical professionals knowing the questions that anti-vaxxers are
Yes.
going to ask. Like, it's so annoying. They shouldn't have to know. They shouldn't have to answer. They should be able to say they're just safe and effective and we did the studies, but that's not the world we live in.
No, and the internet has opened Pandora's box. I think that's the number one thing now with people having so much access to information free. They can look at studies, but I say to people, yes, you can read the studies. RFK, quote unquote, knows the studies, but he
Right.
doesn't know how to interpret the studies. And there's a difference there. And now people who can, yes, do their research. And, I don't knock it to a point. You have questions, there's answers out there, but there's also people who are going to take advantage of those
Yes.
questions and, really push their own agenda on you. And it's easy to say, well, yeah, but the medical community has their own agenda, so they're going to push the same agenda. And you're like, yes, but one is interested in, public health and public good. The other is interested in taking your money or making you a poster child
Yes.
for a movement that has no scientific basis. But I think, if we look at circumstances surrounding your evolution from good faith questioning mom to full on anti-vaxxer, now back again to more of a pro-vax, still questioning, never lose that aspect of it, never lose the questioning aspect. But
Always have anxiety. That's me.
yeah, and, it's fine. And, I have anxiety too. I just hide it with caffeine and, bad food.
Yes.
But it's the idea that you also were struggling to find a community, that you felt isolated, that this community of people who, yeah, you're kind of like, yeah, kind of crazy. I don't know how I feel about this, but hey, I'm welcomed. I had friends.
Yeah.
And that is, I think, a bigger motivator than we give it credit for.
Yeah.
Because now maybe they sought you out. Maybe they looked at you as like, ooh, this is like a ripe one for the picking. We can really kind of manipulate this one here. Or maybe it just happened naturally, whatever the case is. But now you have that sense of isolation, combine that with dissatisfaction and two extremely negative interactions, possibly more, from the medical community that you sought answers for. And now we have a recipe for anti-vax now. We're done.
Right. Yeah. The OB-GYN just said, let's talk about polysorbate 80. I know that ingredient. Let's break it down. I mean, I might not be here talking to you. Like totally different story. It's wild.
Now, the question I get often is, and the question I wrestle with myself, because I do have a social media presence, X, Twitter is a cesspool these days with all kinds of stuff out there. There's also Blue Sky, there's Threads, there's, all these other apps. Anti-vaxxers are everywhere on them. And I wrestle between engaging with them versus trolling them versus just blocking them. And somebody said to me, they said, well, yes, the anti-vaxxer is out there to piss you off. They're out there to make you look bad. But online, I'm specifically talking about the online trolls.
Yeah. Oh, yeah. Yeah.
Specifically talking about online trolls out there. They're really going after people.
Yeah.
But don't not engage because there's somebody with questions that's silently watching the engagement. And it's tough because we want to say they're safe and effective. There's been studies, but then the person who's kind of lingering in the background watching the interaction is saying, but I have the same questions, and I'm curious.
It's tough.
And it's tough. And as somebody who, I know the clinical side of medicine, like to think I do my job well clinically, but I'm not a vaccine scientist. I don't have the answers to these intricate details. It took you to go to a blood-brain barrier specialist to answer at least one of your questions.
Yeah.
That's not me. But let's go back and 10 years ago, and let's say if you talked to your pediatrician and said, well, what about polysorbate 80? What if he had said to you, listen, I'm not a vaccine specialist. I don't know exactly. Let me find out. Let me see what I can look at.
That would have been huge. I would have not felt stupid. I would have been like, wow, they're taking me seriously. That, yes, please, like, you're in this with me. That's crazy. That's amazing. It's
I
understandable if they don't know it right off the bat.
Right. And I've said this, yeah, I said this time and time again to my residents and students. I'm like, if you don't know something, say it. Like the public doesn't expect you to know everything. Maybe they did 100 years ago, 200 years ago, but nowadays it's okay to not know. It's okay to say, let me check in. I don't know. That's a good question. From my experience, it's not this. From my experience, it's this, but let me see what I can find out. Or
That's
at least
huge.
point you in the
Yeah.
right direction. At least be like, you know what, go here. You know what, this is a reliable source. Check this out. Like do something like that.
Yeah. It's very respectable when somebody's, they're honest and they're on your team. That's all I feel like people really want, most people.
I think we as a medical professions have to do better in general. I think with communication. Fauci got a lot of shit. I actually gave him shit personally during 2020. Well, I did because, the answer is, well, masks don't work. And he was doing it in a way because we want to make sure that healthcare workers have masks and not create a run on masks. So he's going to come out and say, you know what? Yeah, masking, I'm not quite sure about that. Dude, just come out and say it. Just come out and say, you know what? We believe that masking is likely an effective source of transmission, but we really ask that our healthcare workers get priority on these masks to protect themselves, whatever. I don't know, but don't just come out and give like a white lie with, good intentions here, because now you've just reduced your credibility. And
Yes,
that has
he
far-reaching
needs to.
consequences. Um, that's my
I
fucking rant.
Yeah, I feel like and this is just my somewhat opinion, but kind of based on, I don't know. He would think things, and maybe this is an off record thing, but he would think things and say things and then say, I can't say that to the public because it's too nuanced and they're not gonna understand it.
Yes. And
That's
I've had that
embarrassing.
conversation with other people. I said, we have to give the public more credit. Now, granted, my biggest argument lately is that the public doesn't want nuance. It's all sound bites, it's all social media clips. So have we lost our
Yeah.
capacity for nuance? I don't know. But I think we have to at least give the benefit of the doubt that, you know what, this is a nuanced take. Let's break this down. No, it's not going to look sexy on social media. I can't make this nuanced bit a 1-minute TikTok clip.
Right.
Okay, but if I'm giving a press conference, I can at least try and offer some sort of nuance and say, this is what we're looking at, this is what we're doing. It's a work in progress here, you know?
Right. I can see that though, the sound bites now, but in general, I think we need to give people more credit. The trust that's lost when you don't just say the thing is huge. And there's so many people that just greatly dislike Fauci now and think he's just an
Hmm.
absolute not trustworthy dude.
Yeah.
And that's huge. A lot of lives were lost because of that.
Yep. I actually made the argument to one of my friends that Fauci was very old school in his thinking because of that. And I've talked about, the age gap, the generation gap in medicine between the, physicians who trained and practiced 50 years ago compared to the physicians coming up now, and the expectations of the population. And 50 years ago, 60 years ago, it was, I'm the doctor, do what I say. This is what we do. And just people just do not respond to that anymore. People
Yeah.
want to ask why, how. Good questions, valid questions, but you're running into, some people run into a generation of doctor that says, well, you're just being paranoid. Well, you're a new mom. You're an anxious mom. It's
Oh, Lord.
fine. And I say to people, so people come into the ER for me for chest pain, for things that I can't explain. And I tell them, listen, I've ruled out infection. I've ruled out a heart attack. I don't have a good answer for your chest pain. I don't want to diagnose you with anxiety. I'm not going to diagnose you with anxiety from the ER. That's a diagnosis of exclusion, because people will say, like, well, is it stress? Is it anxiety? I'm like, sure, maybe. I don't know. I'm not going to tell you that right now. I can tell you what are tested. I can tell you what I've managed to rule out, but really maybe more testing. There may be more discussions to be had here, and I think medicine needs to embrace that. We need to change the message of medicine in the wake of obviously the pandemic, but also just in the age of social media and the internet. It really needs to grow up, I guess.
Yeah, which I have a little thing. I was told I had anxiety. I mean, you're a new mom with anxiety, but for years, and it turned out to be Addison's disease, and
Interesting.
which I just really appreciate this because until I was on medication, hydrocortisone, I would, almost go into an Addisonian crisis. And then I actually did. And I went to the ER, and the nurse was like, I've only heard of this in nursing school. And the doctor came in, and he basically was like, he almost like Googled in front of me and was like working with me on it because he hadn't really dealt with this either. It's one of those weird things. And he worked with me. He got me the medication. He helped. Like, it was just a back and forth, and not at no point did I think you're a doctor and you're stupid. You don't know this. Like, it was just like, oh my gosh, you're listening to me. And I mean, people have died because the doctor, sends them home with an Addisonian crisis. Like, I know more. And I had so much respect for that. But I mean, that was amazing. Yeah, Google in front of me. Like, you know what you're doing. You know how to dissect that information.
Oh, listen, I will tell you a secret, that this is going in the recording, so it lives forever. You're a doctor, especially ER doctors or into, whatever proceduralists, not surgeons. Surgeons are, different. We run into procedures that are not common out of our training. I have done procedures in my training that, I come out, great, we're good. 6 years later, I haven't done it again. So what do? We look it up on YouTube. That is our secret. We're pulling up YouTube, and there's a running joke. There's one of my colleagues has a grill apron, and he on it says, "Trust me, I looked it up on YouTube." Because you do procedures, you do things. We know in our training, we know when to do them. We're trained in doing them. It's not that we haven't done it before, but if I haven't done a chest tube in 3 years, yeah, I'm going to refresh my memory. I'm going to revisit my landmarks. I'm going to look at something, before I go back into it and do it again.
Please do. Please do. Like,
Yeah.
that makes me feel better.
But we're doing it in secret. We're doing a phone like, okay, all right. Hi, I'm the doctor now. Like, that totally happens. Not me. I'm amazing. I don't do that.
Well, yeah,
But
of course not you,
of course
but
not.
everybody else, yeah.
Everybody else. But, like I asked my colleague, I had the other day a patient with a serious ear injury, and there's a nerve block that you can do where you inject anesthetic around the ear to numb the entirety of the ear. And I literally hadn't done it in years. And he had just done it like a week ago or something. I said, hey, can you come in and just like, let's do this together, refresh my memory here. And we did. And the patient was fine with it. He was like, oh yeah, cool. There's 2 ER doctors and a resident doing this thing. And it's like, it's fine to not know something. It's fine to admit you don't know something.
Right. You're still handling it. You're just being honest about it. And that makes the patient trust you.
Right. So obviously, if you're Googling everything, that's a problem. We got to talk. Heather, thank you so much for coming on. Thank you for the conversation. I hope that my colleagues, the general public, really take a lot of this to heart, especially the medical profession, medical community. I think those are the ones who needs to hear this most of all. It's our conversations, our interactions with patients can really frame them for years to come. People look to us as, leaders in the field for a reason. And even though there's a lot of, random crap on social media about doctors, this or whatever, people still look to us and trust us. People still look to nurses and trust you. So your opinion, what you say matters. And I think it's important to also look at things like isolation and friend groups and all these things that society has that can shape somebody's opinion. Be patient and respectful. That's, I think, the biggest takeaways of a lot of this.
And I think what you said about the pandemic sucking and things just sucking, I've had a lot of medical professionals come up to me and say, I'm just so tired. And like, it's just hard. It's hard. It sucks that we're in this situation. And it's okay to just say this really sucks and it's really hard. I hate having to do this, but keep up the good fight. Cause I mean, you can see that little things you do impact somebody possibly for life. And it's worth it,
Even as a student. Even if you're a medical student, keep that in mind too. You're
absolutely
still
huge.
All right. Well, Heather, thank you so much for coming on. I'm sure we'll be in touch later. Heather Simpson, she is on social media, not doing the anti-vax thing, but she does make guest appearances. I was lucky to have her come onto my show to discuss something very important, especially in the age of RFK Jr. So, Heather, thank you so much.
Thank you for having me.
And so ends another episode of the Jaferd Cast. Open communication, honest dialogue, those are things that we need to do better as a profession. That's nothing new. We hear that oftentimes in residency, in clinical training, and just in general, even in our hospital modules, which, annoying as they are, do hold some element of truth to them. Listen to her and others' testimony talking about why and how we can do a better job of communicating to our patients. And maybe, just maybe, people like Heather Simpson won't actually go down the rabbit hole to begin with. Be honest with our patients, be honest with yourselves, know your limitations and what you know and don't know. And as I tell everybody at the end of every episode, don't take my advice as gospel. Do your own research, talk to your own doctor, because at the end of the day, I'm just another freaking ER doctor. Take care, everybody, make good choices, and we'll see you next time.